Hello, my name is Rupa Kitchens. I'm with Urology Centers of Alabama, located in Birmingham, Alabama. I've been with this group since 2006, and one of my main specialties or interests in what I do every day is female incontinence. Incontinence just simply means the involuntary loss of urine at a socially inappropriate time. And believe it or not, this problem affects several people, obviously in our practice, but also countrywide. There's about 33 million people in this country who suffer from incontinence. But sadly, probably only about 10% of those people actually make it into a doctor's office to talk about this very common problem that can easily be fixed for the most part. Incontinence, as I mentioned, just simply means leakage of urine. Usually it's done involuntarily, and again, as I mentioned, at a socially inappropriate time. And there are several different kinds of incontinence, which takes us back to the sources for the leakage as well as different types of treatment. It mostly affects women. The average age is anywhere from 50 to 70 years old, though it can vary. Incontinence affects so many people in this country, yet so few actually come to the doctor to actually talk about it. And at the same time, the physicians also simply tend to forget or not talk about it as much with their patients, simply because the patient may sometimes have so many other medical problems that are more pressing and that may take up more time in the office when that doctor is with the patient. Incontinence of urine is a very easily fixed problem for the most part, but so many people don't come forward because they think it's part of the natural aging process, or because, say, their mothers may have suffered with it and they think it's normal for them to have it, or they're simply embarrassed to bring it up in front of their friends or doctors to get support. But we do know that correction of incontinence does improve quality of life in several places. It can affect the workplace, it can affect family life, it can affect sexual activity, it can affect a person's self-esteem. Certainly if a woman is incontinent of urine and she's going to the bathroom frequently, for example at her workplace, she may have some trouble dealing with her employer and not getting good work productivity done. As far as home life, some women just don't even want to leave the house because they're afraid they're going to leak urine if they go out. And a lot of people become homebound or just don't like to participate in hobbies and travel like they usually would because they're just simply afraid of having an accident. Also, it can interfere with a woman's sexual relationship with her partner because sometimes leakage can happen during intercourse. So there's several different facets of our lives that incontinence can be pushed into, and that's the reason for addressing this problem more and more, because it can improve quality of life if treated appropriately and in a timely fashion. And we're trying to get that to the patients now as much as we can. As I mentioned, there are several different kinds of incontinence. The first kind is what we call stress incontinence. And stress doesn't mean that you're stressed out or something's bothering you, but actually it refers to any kind of pressure or stress that's put on the abdominal muscles, such as coughing or laughing or sneezing or perhaps exercising, jumping, lifting things. It can simply also be going from a sitting to a standing position. And when that pressure is transmitted to the abdominal muscles, it gets then carried towards the bladder. And sometimes the bladder just simply can't overcome this pressure, and that urine in the bladder that's stored will leak out. And again, it's not meant to leak out, but that's just simply from the pressure from the abdominal muscles. This is usually something that can happen after childbirth, simply from wear and tear of the pelvic floor muscles during pregnancy and delivery. It can be worsened by aging, it can be worsened by weight gain, cigarette smoking, and pelvic surgery. But it is a very common problem and simply is just from wear and tear of the pelvic floor muscles, which we all have. And at one point, these muscles are very, very tight, but as women have babies and have hysterectomies and that kind of thing, this muscle can get very flabby and not so tight, and it needs to be fixed at that point. The way to take care of this is simply to rebuild the muscular support. Sometimes this can be done with surgery, or it can be done with simple conservative exercises that can be done at home without any surgery. The other kind of main leakage that we have is called urge incontinence, and urge means you can't put off getting to the bathroom. You have to go right away, you can't finish what you're doing, and inevitably there is leakage of urine on the way to the bathroom. And this is a different type of problem. This is the bladder muscle. It has become hyperactive with the nerves and that kind of thing, and it is an involuntary contraction of that muscle. And the way to take care of this is simply with medication to calm the bladder muscle down so that one can finish what they're doing and make it to the bathroom in time. This is also a very common problem. Another kind of incontinence is called mixed incontinence, where you have a combination of both the stress and the urge, and you would literally just treat both of them in its own way for each one. Sometimes people need medicine and surgery to take care of all of their incontinence. Lastly, the fourth major kind of incontinence that we deal with is overflow incontinence, and it simply means just that. The bladder is overflowing, and this can be a result of inadequate bladder emptying. And we see this sometimes in men with enlarged prostates or in women who have a bladder that doesn't work well anymore, and that can happen with diabetes or some kind of neurologic problem. And the trick here is just to diagnose it correctly and get the bladder emptying better, and that should take care of the incontinence. So we see all of these very commonly, with the mixed incontinence probably being the most common, but I would say that as a take-home point, that incontinence is extremely common. It is very important to quality of life measures, whether patients want to believe it or not. Once they're taken care of, they have a whole new grasp on life and are interested in doing things again, and that's what we would like to do for our patients as far as increase their quality of life by taking care of this very common problem. So to summarize, again, we have four major kinds of incontinence. The stress type of incontinence is a pelvic floor muscle problem, not necessarily a bladder problem like everyone believes, and is taken care of with surgical therapy or conservative exercises at home. The second type is the urge incontinence, which is taken care of with medical therapy to basically calm the bladder down. And the third is the mixed type that we mentioned. And the fourth is the overflow incontinence, which results as bladder emptying. I would strongly encourage anyone who has incontinence to try to talk to their doctor and bring this up with them.